Dr. Sinskey, thank you for joining us here tonight. I think it would be interesting to start off with just a short description of your initial glaucoma diagnosis and the treatment that was associated with that.
When all your ophthalmologists, you've treated all these things, but when you're sitting on the other side of the table, it's a whole different situation. But when I took my oldest daughter and her family to Alaska on a cruise, and I noticed on the cruise that was in the year 2000, it was 12 years ago, and I noticed there was a little difference in contrast sensitivity in the two eyes. And when I was a resident at Duke, we used to practice tactile tension on each other and see if we could guess it right. And we could guess it right pretty good after a while, and I never lost that completely. So I began to check myself on the boat and realized that this pressure was higher in this eye than this eye. And when I got back, I had my nurse check the pressure, and it was 26 in this eye and 17 in this eye. I also, the cup was slightly larger in this eye than the other eye. My visual fields were normal. So I started treatment then. Actually, I've had ALT and SLT. It's an exfoliative type of glaucoma. My family history goes back to the Ukraine, where it's very common to have exfoliative glaucoma, exfoliation. So I went along fine for years with these various treatments, and I'm allergic to beta. I get asthma with beta blockers, so I couldn't take Timoptic. But I've been on Zalatan, and then when it started to get out of control, I got into the pilocarpines, and and I even got into phospholine iodide, which you had a hard time getting, and it gets a little scary. So anyway, I decided I'm getting near surgery, and I didn't want to wait till I got severe visual field defects, because sometimes those things seem to keep going no matter what. So I didn't want to. My own experience with treating glaucoma, and I've probably treated thousands, but I was very happy to be firm when I got thoroughly involved with cataract surgery and implant surgery. I was happy to send all my glaucoma patients to somebody who really knew what they were doing, or at least they thought they knew what they were doing. So I didn't want to have a filtering operation. So I checked around, and Canaloplasty came up. I'm on the advisory board of the Duke Eye Center, so I took my residency, and they mentioned Canaloplasty. And then I called up another friend of mine who was a chair at UC Irvine, and he recommended the same thing, and he recommended Rick Lewis up in Sacramento. So I called up Rick, and we went up there. Got there at 10 o'clock in the morning, and it was about 110 in the shade in August. And Sacramento is a hot town for temperature reasons anyway, for no other reason. Anyway, he operated on me at 1 o'clock, and then my wife sitting over here drove me over to Napa, because I have a home over in Napa, and checked the pressure the next day. It was running 30, and the next day it was down to 8. And then I got a little nervous, because when I got back came back down to Santa Monica, and there's a young doctor in the town next to me that does the same thing, but he's only done about 10 or 15 canaloplasties. So the pressure went back up to 25 and 26, 28, and I was getting nervous. He said, "Stop worrying." He said, "Sometimes it takes a couple months to come down." So it's easy for him to say to stop worrying, and when you know that you're losing cells which never come back, when your pressure's up, you get a little nervous. So anyway, I had a check with Rick about 3 weeks later, and it was still up. And then at 2 months, I went back, and we both got nervous, because I'm kind of a hard profile type. And he decided to blow a hole in Decime's membrane. And since then, it's been 10 and 12. And that was a couple years ago. No drops.
Now, speaking of drops, you mentioned a couple of drops that you were on. How did the drops impact your lifestyle, if at all?
Well, the biggest problem when you get to be this age, and I'm 87, is that you're not only on that, not only the eye drops, but you're on some pills for your prostate, and you're on pills for whatever. So you're on about 10 or 15 pills, and you got to line them all up. And if you travel, and the time sequence screws you up that way too, and then you add drops on top of that. And then the biggest problem is, did I take the drops or didn't I take the drops? Or did I take the pills and didn't I take? And you know, a lot of people have problems because they overdose or they underdose. And so the less you do, the happier your life is. And I can't tell you the difference between not worrying about eye drops and in addition to all the other stuff. This is incredible.
And you mentioned that you preferred to avoid a filtering procedure. Why was that? And what about canaloplasty enticed you?
Well, these filtering blebs are all, you don't know what kind of how much is going to bother you, how much is going to be irritating, how thin the conjunctiva is going to be. You don't know whether you're going to over leak too much or leak not enough. And also, if you get infected, you can cause endophthalmitis. And I travel a lot. We've traveled a lot. We've cut down the traveling a bit. But it's nice to avoid. I have a hospital in Ethiopia, and I'm not really happy about getting an intraocular infection in Ethiopia or any other place. So the safer the better, and the more comfortable your eye is. It's nice to have a comfortable eye without a bleb.
Right. And we really appreciate your time. I have one more question for you.
Okay.
Are you satisfied with the outcome of your canaloplasty?
Let me ask you a question. How could I not be satisfied with it?
Thank you very much, Dr. Sinskey.